And welcome. Today, I think that we'll be swept up in the enthusiasm, the commitment, and the people power of friend and colleague Laura Tamblyn-Watts. Laura is a lawyer, an advocate, a researcher, a media commentator, and much more. She's president and CEO of a relatively newly established NGO in Canada, which I believe will have far-reaching effects in terms of its advocacy for Canadians and internationally. CanAge's mission is to advance the rights and well-being of Canadians as they age. What is particularly important about CanAge and Laura as an individual is that the work turns intent into impact. You know, Laura's got a background and interest in law, ageing, abuse, accessibility, law reform, governance, and knowledge mobilisation. I think one thing that I know to be absolutely true is that Laura disrupts positively all the time. There are no barriers to what is possible in Laura's work in advocating for the rights of older people. So it's a great pleasure for us to have Laura with us this morning. So I hand the floor over to you, Laura.
Good morning, good afternoon, bonjour tout le monde. Thank you so much. There's a wonderful collection of old friends and new friends, and it's my great privilege to speak to you today. I've been a big fan of the town halls, and depending on which time zone I'm in, that's either earlier or later in my day. I am on the moment in Atlantic time in Nova Scotia, so I'm just about as late in the morning as you can get in Canada, and that's quite a bit different from when I was listening in from British Columbia 4 hours earlier. I'm so delighted to speak with you today, and I just want to take a minute to acknowledge the leadership of the International Federation on Aging. They are always at the forefront of our discussions on what we can do to support older people worldwide. In this time of COVID-19, however, they have really stepped it up to be able to host these types of quality town halls on such a regular basis and to provide people with the opportunity to connect, to learn, and frankly, to support each other through this very difficult time has been, at least for me, a great resource and inspiration. And I'm sure by your attendance today and at other town halls that's been the same for you. So a big thank you to the International Federation on Aging. I also want to recognize some of the wonderful Canadian experts on this call. I know that there are many, and I just want to particularly call out Margaret GILLIS from the International Longevity Centre of Canada, Marie Beaulieu from the University of Sherbrooke, and many more I see in the chat as well. I have some of my colleagues from CanAge in the chat right now, and I wanted to acknowledge Christiane Book. We also have Paula Annabelle, Diana Cable, and a few others who are going to help to support the chat. So I encourage you to use the chat on the way through while I'm speaking or while you have questions or thoughts that you'd like to raise. And we have some of our CanAge team that can help to answer things in real time for you. I also want, as we must do always, to thank the Indigenous original owners of the land. I am in Nova Scotia, but we are on Zoom and we are global. As we are thinking about what we're talking about today in terms of a roadmap for Canada, it's critically important that we also acknowledge from whence we came. So thank you and a blessing to all of those who have come before us. I'm very excited today to announce really the launch of a national platform on aging for Canada, which is essentially what it is. And I'm hoping I can speak to you a little bit today about how we got there, what the context was, what some of the key elements are, and kind of where do we go from here. I'm really excited about the question and answer. And so I'm hoping that as we go through, you'll give us the gift of your expertise and also of your thoughts and questions, because for me and for our team, your commentary and thoughts would be enormously helpful. So I just want to start by talking a little bit about what the situation in Canada has been, and then how COVID changed it in order to set the context. So in Canada, we have not had kind of an established policy framework Some have called for a national senior strategy. There have been drafts of things that some people have put together over the years. There's been a recent passing, although not really implementation, of a national dementia strategy. But Canada has not, as a government, as a nation, had, if you will, an overarching policy framework that allows both government and NGOs and citizens to come together in a coherent way in order to improve the lives of older adults. And as a result, we've seen some of those cracks really come to bear within the COVID-19 system because we haven't had a policy framework or a policy strategy. It's been very much left to our regional governments to respond in kind of a negotiated way with our federal government. So let's start there. So Canada is a federated state. And what that means is we have a federal government that's responsible for some things, in our case, including things like public health. And we have provincial and territorial governments who are responsible for other things, in our case, the implementation of health. We have a universal healthcare system with some cracks in it as well, long-term care, and I'll use that as a term to include things like nursing homes, anything that has congregate 24-hour care, that's kind of part of our medical paid system. Our long-term care system is not embedded into some of the healthcare systems in as seamless a way as possible, and that again came to the fore. Canada is a wealthy country. It's a country that overwhelmingly values its social services, and so we lean more to sort of the Nordic model than we do to an American model. So the situation in Canada, we have about somewhere between about 36 and 38 million people, depending on which survey you're looking at. And almost all of our regionality is very close to the American border. And that becomes important because when we're thinking about service delivery, it's a vast, vast landmass, and rural and remote issues are important. So our background is federated country, kind of a shared division of powers for some aspects, which makes, of course, policy much more complicated than if you were one country with one set of laws. So we have to negotiate, and that is overwhelmingly an important driving force in how we manage policy in Canada. So we were challenged at CanAge to try to contribute meaningfully, particularly in the time of COVID-19. And we thought that what we could do is not just try to respond immediately to the issues raised by the emergent situation of COVID-19 in Canada, but we could at the same time pick up a pen and do some of that hard policy work, because we were all in a circumstance where, driven by the need to try to improve things, we thought that we could try to add this. We couldn't ourselves, coming from our backgrounds, be in the front line. We couldn't ourselves be at the front lines, helping people in long-term care homes. But what we could do is pick up a pen and do what we do best. And we're very humbled to offer this for your consideration. You'll see the policy platform in the chat. And it's called very specifically Voices of Canada's Seniors, a roadmap to an age-inclusive Canada. It's not called the National Senior Strategy. And why that's important is we wanted to offer a framework, as other countries have offered frameworks, and we were inspired by the elder justice framework in the US and some of the other European frameworks that have been done, that didn't come from a medical model, that valued the contributions of communities, that looked at how NGOs can work together and really have a look at the issues in a broad and comprehensive way. We're hoping that as we use this roadmap, that other organizations, researchers, governments can come together and identify particular areas that they will work on. So we're offering it to the country with as much humility as anyone can possibly offer, because of course, no particular roadmap is perfect. It's important also in this context to remember a little bit of how COVID-19 has impacted Canada, because it does impact our thinking in what was included in a priority basis in this roadmap. So Canada in some ways has been a tale of two realities for COVID-19. While only 18% of all cases involved long-term care homes, so again, that nursing home environment, only 18% of cases as of June, 81% of our deaths were in long-term care home. We also had stark differences in responses, and most notably impacting on the Canadian psyche was the difference in the response of our British Columbia government, which is on our far Pacific coast, above kind of Seattle, if you're looking in the American context, where the first cases of COVID-19 popped up in a congregate setting, and there was a very swift provincial response. And while they certainly have had losses, and in recent week, a bit of a spike, that's quite different from the responses that we had in Ontario and Quebec, our most populous and most wealthy provinces, where the loss of life was tenfold in long-term care than it was in British Columbia. So we were also motivated by the reality of how policy and how responses to emergent situations don't just frame our thinking, but they actually, in some cases, are a life and death circumstance. So again, a tenfold loss of life in Ontario, Quebec, because they had, in many ways, very slow policy and legislative responses to the COVID-19 pandemic. So again, a bit of a two solitudes. So I thought I would speak a little bit to the development of this roadmap. So we at CanAge are a team of multidisciplinary folks who come from law and social work, public health and communications. We have people who have expertise in, audience development and marketing and media. And we have people who have academic expertise in medical sciences. It is a truly interdisciplinary organization. And we also have a framework of fellows. And so what that means is we have experts that we can draw upon who are part of our organization, who we can work with on a regular basis to draw in their degree of expertise. And we invite you to have a look at our CanAge site, which is canage.ca, canage.ca, and you'll see our team and our fellows there. And boy, did we use our resources. So these are experts in health, infectious diseases, ethnocultural experts, leaders in Indigenous peoples, and they are organizational leaders as well in many cases. So we were able to leverage many of their organizational responses. So we started the consultation process, and we wanted to recognize the tremendous amount of work that had been done before. And so this roadmap isn't, if you will, necessarily all original ideas. What this is supposed to be is a place where once we picked up the pen, we could honor the work that has been done before, as well as the priorities in the moment. And so as we did this, I just wanted to speak a little bit to how we did a consultation. Now, it's important to remember we were doing all of this in the time of COVID-19. So our travel was almost non-existent. So we were doing this on telephones, we were doing this on video. In some cases, we would have, where it was possible, a very distanced conversation, perhaps with one person, but overwhelmingly it was done through electronic means. And that's important to remember. You can't always consult with everybody in the same way. But again, it was a coalescence of already in many cases existing knowledge added to that. So who did we talk to? We sent out invitations to all of the provinces, territories, and federal governments in Canada. And we focused in the areas of seniors, economic development, finance, housing, health, public health, and I call those differently because public health has a slightly different mandate than our health, which is about our delivery services. We focused in on those particular areas. Then we worked with our key stakeholder organizations, our leading NGOs across the country. So those are organizations like, for instance, different Alzheimer's societies, United Way, Red Cross, etc. Then we went and looked across our networks. So we have many, many networks in Canada. So for instance, our elder abuse networks and other networks and associations. So we talked to professional associations. And we did that as well with a call out to individual older adults. And we got hundreds and hundreds of responses. And so we actually set up phone calls with all older adults that wrote into us. So we actually had some of our people phone them and we asked them whether or not we could use their names and information and so on. So we had about, I don't know, a few hundred kind of in-person impacts from older people across this country. We really talked to everyone we could. We talked with, archbishops. We talked with people down the street. We talked with rural and remote communities. We talked with Indigenous chiefs and representatives from a wide diversity of our Indigenous and ethnocultural different communities. We did it in English and French and any other language that we could also scrounge up. And it was interesting as we were trying to marry the information that we were hearing with also the expert research. It's important to remember that we have had robust research and we have had, good policy, but what we haven't had is one place to look at it in the same. So we dug into the Cochrans and the Campbells. We dug into our academic research and literature. We reviewed commissions and inquiries and coroner's inquests as best we could across this country. We spoke with pension organizations. We spoke with big financial institutions. Wherever we were trying to do our consultation, we were thinking both about the powerful and the people who maybe don't have as much power. After we did that, we coalesced the information always through a variety of lenses. And part of what we did at the beginning was work to create what we called our lens statement. And you can see this as well online and in the roadmap. But I just want to take a moment to express to you the importance of using the lens to try to understand a bit on a more forward basis the differences experienced by people with perhaps marginalized experiences or historical disadvantages in the Canadian context. I'm just going to take a moment and read for you some of those lenses, and I'll also put them, I'm going to encourage some of my team members to put them in the chat. So we look through the lens of accessibility, neurodiversity, and cognitive impairment, Indigenous rights and experiences, ethnocultural diversity, immigration and what we call newcomer status in Canada, sexual orientation and sexual expression, gender and gender expression, access to justice, human and civil rights, intersectionality, the life course perspective, socioeconomic status, and a trauma-informed experience. So as we were doing our both gathering of information and figuring out who we would speak to, we were directed by some of those lenses. And then we made sure that when we were reviewing and thinking about key issues and policy recommendations, that each one of those had to go through each one of those lenses. That was our effort to make sure that we could honor often voices who are perhaps a little bit more scarce or who may have differential experience impacts. As we came to what we call 6 compass points on our roadmap. And again, I'll encourage some of my team members to perhaps copy the 6 compass points into the chat. But they are the 6 compass points that we were able to kind of summarize and group around. And they are violence and abuse prevention, optimal health and wellness, infection prevention and disaster response, caregiving, which includes in our case, long-term care, home care, and housing resources, economic security, and social inclusion. When we were reviewing the materials and we were trying to make sure that we had as good an understanding as possible, it was important also to remember that this was a coalescing of key areas. And so under each of these 6 compass points, we came up with key issues, which you'll see, and then recommendations. It's supposed to be a living document. So it may be that we actually are successful in checking things off the list. It may also be that we are successful in evaluating how the roadmap has done both in guiding decision-making, and in providing an opportunity for collaboration. So this is not a CanAge document in the sense that it only belongs to us. The goal was for NGOs, for communities, for governments, for policymakers, for stakeholders, and for individuals to be able to find where they might locate themselves and they may be able to engage and support. So right now, one of the things I would really love to ask the experts on this panel is guidance in how to create a really profound evaluation matrix. We're working on it now, and that's an area that's certainly something that I would love your guidance and support on. So we're thinking about it being, you know, organizations, groups that would both sign on and support different areas, but then may take an individual issue on themselves as a leadership area. So we're not leading on all of it. Indeed, I just want to speak a little bit to how we're activating around it.
Okay, Laura, I'm going to ask you to start wrapping up because we've got a plethora of questions here. So we need to have some space and time to ask all these questions.
Absolutely. Well, that's perfect because I was on my last sentence, so it's good timing. So as we're moving forward, what we're hoping that you'll be able to consider doing, particularly those from Canada, but anyone is welcome, on our National Seniors Day, which is the 30th International Seniors Day as well on October 1st, we're hosting and co-hosting with the IFA and many other partners our discussion on how we can make Canada more age inclusive. And then we have a series of free webinars as well from October 2nd to October 6th, and we'll put the information on the chat where we delve into each one of these issues individually. So I'm hoping in our discussion today, we can talk a little bit about what the substance is. I can answer some of the questions that are in the chat or that you may have, and that I can learn from you about how this roadmap may be useful in the Canadian context.
Okay, look, thank you. What a wealth of information. While you're talking about the event that CanAge and others are going to be having for the UN IDOP, for the IDOP, I just want to acknowledge Cynthia Stewart, IFA's main rep at the United Nations, but also chair of the NGO Committee on Aging. And the NGO Committee on Aging, is planning a phenomenal celebration of older people. It is the 75th anniversary of the United Nations and the 30th anniversary of the International Day of Older Persons. So I have the great pleasure of moderating the interactive panel. And so I just want to have a call out here, and we will share with you information about that event next week. Now, Laura, I'm going to offer the first question. Now, I've been in this field for decades and decades, and I have seen plans come and go, and come and go, and come and go. I can even tell you that Ethiopia has an excellent plan for older people. One of the fundamental issues with plans is there is no money. So we can write plans and frameworks and strategies, but if there is no money from the government, to inform the plan, then nothing changes. So that's one question. The second one is, as a proud soon-to-be Canadian, if immigration can look at my application, it really concerns me that services in Ontario are quite different to those services in PEI for Canadians. So there's discrimination inherent in the structure. So perhaps you could comment on both of those, and then I'm going to ask Dan Herter and Santiago Cambiro to ask their questions. Thanks, Laura.
Thanks very much. As we are thinking about how funding happens, it's important to be able to articulate first what some of the issues that we're thinking about and where the very specific needs are. So yes, it's important to remember that CanAge does not have a federal checkbook in its hand. But what policymakers have not had, in our respectful view, is kind of a coherent review of what the key issues are in Canada and what specific recommendations might be. Absolutely. And so what we're hoping is this roadmap will provide an opportunity for NGOs and policymakers and communities to function and work together and be able to parse out where funding can happen. There's absolutely no question that you're right, Jane. Dollars need to flow. The question about the inequities, which are fundamental in a system in Canada, which is a federated system, is a huge issue. And we talk a little bit about people shouldn't be discriminated on the basis of postal code as well. So not just different provinces and territories having access to different services, but within those provinces and territories, service delivery is quite different, for instance, in rural and remote communities than it is in urban centers. It's a huge challenge. Where we're hoping in some specific areas, and long-term care perhaps is one of those ones we could speak a little bit about because the responses have been quite different. We're hoping that where we can develop some key standards and finally come together with our federal and provincial and territory governments and establish some standard-based norms. But nobody in Canada can tell any other province or territory what to do. And that is, in fact, the real challenge. So it is a basis of norm building and making sure that those norms are then turned into action. It's not easy, and I don't have the answers for it.
And I think also it's about not passing the buck. What we hear in Canada and see is it goes back between federal to provincial to backwards and forwards. So, Dan Herter, are you able to come forward?
Hi.
Good morning.
Good morning, everyone. So my question really comes from the corrections side. My job right now is working with the Aging Offender section in Correctional Services Canada. And so the question came to mind when I heard the broad consultation that was done for this work. It was amazing. Was there any consultation done with folks from exiting the correctional systems, either provincially, federally, or with any of the advocacy groups that work with our offenders?
Thanks very much, Dan. And really important that the issues of inequity, particularly within our corrections system. So this is actually a passion area of mine, and I've had an opportunity to work kind of in this area with some of the ombudsmen, and I've worked with Ivan extensively and co-presented with him. And that's one of, I'm using the name, pardon me, one of the leaders in the field of correctional oversight in Canada, our federal ombudsman. So we were informed by the reports that have come out this past year on aging in offenders, and we were also informed by some of the previous reports that were done by his predecessors. I don't know if I ever spoke to anyone who has a criminal record because I didn't actually ask that question. But what I would offer is that we certainly use the literature, including the excellent reports and our expertise in connecting with the folks who made those excellent reports about aging offenders, particularly concerning in the time of COVID-19, where many of our correctional institutions have had great concern about COVID spread. And we think about aging differently, particularly we think about sort of 50 plus in the correctional system as an older person. So we didn't, and I saw one of the other chat points asking about sort of age specific. So we don't specifically use an age when we were reviewing it. Certainly in Canada, we have some programs that launch at 65, some programs that launch at 60. But when we were looking through our lens statement, we were trying to make sure that we were very inclusive and took a life's course perspective of aging rather than an age specific moment.
I just want to also have a shout out to the corrections who reached out to IFA and we welcomed their translation of a recent infographic which raised awareness around the importance of vaccinating against respiratory diseases, pneumococcal and influenza. So thanks to those. So Santiago and then Margaret Gillis. Santiago? All right, we'll move on to Margaret and come back to Santiago. Margaret?
Hi, Laura. Thank you so much for all your work and for the work you do all through COVID and since the beginning of CanAge. My question is about the federal government and provincial governments in terms of your discussions with them and if you've had any response yet to the plan. Of course, my fingers are crossed that they've been in contact and are responding well. But I'm just curious to see how that worked for you and the kinds of things you've heard back from them. Thank you.
Thanks so much, Margaret. And thank you for your leadership, particularly in the area of human rights. For those who may not know, Margaret has been at the forefront of our human rights discussion in Canada and comes from rich experience in government prior to her work in that space. It's been very interesting. I've been working in the field a lot of decades and working with governments as well, and I have never actually experienced such an interesting uptake. So our invitations that we sent out were overwhelmingly accepted. We did hundreds of interviews with policymakers across this country, including elected officials, and often, got meetings with ministers that ordinarily might have been quite difficult otherwise to get. But there was a sense of urgency, I think, in the time of COVID-19. And so they were actually hoping for answers for us, and we were hoping to consult with them. So in our questioning, which we had sort of a general format of questioning, but we also had some very, very frank discussions. What's happening in your community, we would ask them. What are the issues that you're worried about? And they were very forthcoming in a unusually candid fashion, because I think they were really all struggling with the situation in COVID-19. I don't think we would have had that degree of uptake and frankness had we not done it in the middle of a national, indeed an international crisis. We have not gone back to policymakers. In fact, our letters are going out, I believe, today. So I can't say how the response has been, but the response to the consultation process has been dynamic and rich. We actually spoke not just with ministers and leaders of parties and what we call shadow cabinet ministers, which are people who are leaders from the other parties, but we actually had very high access to our civil service as well. So an unusual amount of interest. Uptake, we'll have to see.
So I just want to acknowledge Jane Teasdale, who is the CEO of Mosaic, just telling us in the chat box that they are also planning an event for International Day of Older Persons, and perhaps the IFA team can actually collate some of these and put them out through the Voltage. I just want to go back and ask a question about COVID fatigue. I'm now 29 weeks in working remotely, and IFA certainly won't be going back to the office anytime soon. How do you think COVID fatigue is going to impact policy development in the context of austerity measures? Governments cannot deliver stimulant packages, the size of which I've never seen in my life, and without cutting somewhere. If we look at the balance and we look at the ageist attitudes that have occurred during the pandemic, what do you think is going to happen in the future? COVID fatigue, austerity measures, where do older people fit in the policy landscape?
So that depends, my answer, on whether I've woken up in an optimistic mood or not. I have to say, I usually start off a lot of our conversations by saying, austerity is coming. There is no bank machine that can let us print money in the way that we are doing in Canada without cuts, and they're coming sooner than later. So for folks on the call, it's important to get a good sense that in Canada, our federal government has worked with our provincial and territorial governments in an unusually good way. We're usually at each other's throats, but in this particular circumstance, there's been a general coming together, in some cases of bedfellows that would never usually even speak in an easy fashion. And checks have been written like have never been written before. And so that is going to come out of somewhere. I think, pessimistically, that based on previous track records, cuts to seniors have been historically one of the places where the dollars get taken away from. Well, there's a lot of good talk, and that's been a real challenge. So one of our hopes for this roadmap is to try to transform some of the intent of good talk about seniors into something that's concrete that people can advocate for. Do I think it's going to be easy? No, I don't actually, Jane. I think austerity is coming.
So look, thank you for that question. I'm just going to read a question from Alice, if you don't mind. And Alice comes from Widows for Peace Through Democracy. There is already an unprecedented worldwide increase in widow numbers due to many factors such as armed conflicts, migration, natural disasters, and epidemics of disease. now including COVID, with also, of course, the disproportionate impact of COVID on older people. Does your roadmap to age inclusiveness include any specific provision for the needs of widows?
Thank you so much for the question, and thank you so much for your work, Alice. We did speak to several experts on widowhood as part of our consultation process. Widowhood, and we spoke not only of widowhood, but also of people who have experienced grief and loss, but your question was specifically around widowhood. We did include that as a part of our lens of both sexual and gender orientation, and we looked at that as a trauma-informed aspect. When we were thinking about what trauma-informed means, we were also thinking about grief and loss. We specifically also worked on the issue of widowhood within our pension and financial aspects, because in Canada there are some significant implications for that. And so I would love to learn more about your work, and I would love very much to find out how we can build upon your expertise and make sure that we infuse it into a greater degree into our work.
So I think, Alice, Laura is saying she's coming to talk with you.
Kind of am, yeah.
Right, okay. I also now just want to turn to the whole issue of the rich cultural diversity of Canada and how that has been gathered up in this roadmap. I read just recently that there are over 200 languages spoken in downtown Toronto. So how have you woven in the importance of our rich community in this important roadmap?
I think it's important to start by saying, you know, we could not speak 200 languages, but we spoke all of the different languages that we could muster. And we worked with multicultural and ethnocultural associations, as well as multicultural and ethnocultural experts. We worked through the supports of, for instance, Professor Karen Kobayashi, who is really one of the acknowledged experts in Canada and internationally on ethnocultural diversity and aging issues. We did outreach, as I say, to a wide variety of religious and ethnocultural and immigrant and newcomer communities. Do I feel completely confident that we got everyone's perspective? I certainly don't. What I can feel is that we've done as good a job as we can to make sure that we were focusing on those lenses.
What did you find? What did you find in these concepts? Because it's quite clear, Laura, that the consultation process has comprehensive, in-depth, and touching stones that many of us don't in normal day. But what were some of the conversations, when you talked with people from minority populations?
It was also infused by, I think, the fact that we were talking about them in the time of COVID-19. So I think that situational aspect can't be underestimated. We spoke a lot about the role of intergenerationalism and intergenerational families, a lot about the impacts of immigration and newcomer status. So aspects that would have to do with financial or tax implications were in many cases top of mind. There were, as you could imagine, concerns outside of large urban centers about getting information in languages and in formats that made sense to people who don't speak English or French. In, for instance, Toronto, which is a large urban center, the most multicultural city in the world, there's a lot of translation resources. That's not true in many communities. And so there was, I think, an expressed frustration that access to services didn't make sense and they weren't necessarily able to access those services in a way that they could. There were concerns about abuse and neglect. Those were expressed in a variety of circumstances. We certainly did hear a real cultural diversity about the role of long-term care. And we heard, particularly in the time of COVID-19, and the role of caregivers. And what does it mean to be a caregiver in different communities was certainly an interesting cultural norm. And so really it was a great diversity of opinion, overwhelmingly infused by worry of COVID-19.
I'm going to now really switch, and I just want to acknowledge Margaret Gillis once again, but in a time where Margaret was wearing a different hat, and that was a hat, Margaret, when you really led the development of age-friendly work in Canada and internationally, and that was with Alex Kalash. So that's the context. And now I'm going to ask Kathleen Brasher from New South Wales to come forward and ask a question. Kathleen?
Thanks, Jane. And I'm in Victoria.
Oh, sorry. So
we're in lockdown. New South Wales isn't, but thank you. And
you
good evening, everyone.
If you were in New South Wales, I apologise.
That's okay. Laura, thank you very much. It's such a delight to hear the comprehensiveness of such work gone into the roadmap. But given Canada's leadership in the age-friendly movement, not just within Canada, but globally, and within Canada, I'm certainly thinking of the work that happened in BC and in Ottawa and Quebec and in Nova Scotia. The leadership both in policy and in research, and I'm just wondering where that very deep grounding work sits with its roadmap, because it's such an extraordinary contribution that Canada's made to the globe.
Thank you so much, Kathleen. I mean, I really think that the leaders, so many of whom are on this call today on age friendliness, really helped to set the stage. So we took it almost as a given, if you will, like that was part of the framework. And we built upon the notion of age friendliness to age inclusiveness. So we wanted to be able to leverage the previous work that was done. And there's a lot of understanding in terms of the notion of age friendliness in Canada. You can go to different communities and people will speak about age friendly communities in a way. And so instead of calling it like a senior strategy, which is something that feels quite imposed on people, we wanted the roadmap to be infused by the expertise and experiences of those who have contributed so richly. So I think actually on top of it, the idea of moving to age inclusiveness really is a child of age friendliness in that way. And we're trying to be able to bring that expertise to bear in other areas. And so not just to be friendly, but to actually be that bit more active. And that resonated with some stakeholders that ordinarily might not have been part of the age-friendly community, like financial regulators don't necessarily locate themselves within the age-friendly area, but we're speaking with them about being age inclusive. They could kind of grasp where that meant. So it was, I think, central in our thinking, and we were inspired and engaged with the work that was done. And we tried to kind of open it up a little bit from the basis of age friendliness to an age inclusive outlook.
And it may be something that you want to consider going forward, and also because I think the value of age-friendly environments is intrinsic to all, the age inclusiveness agenda. So I really think that it is a pillar, and the importance of the 4 action areas of the decade of healthy aging cannot be put to one side, because as soon as we put it to one side and not pull it through, then it's off the government agenda. So that could be something to consider. I'm just going to ask Valerie Powell to come forward and Maria McLaughlin. So Valerie, are you able to come forward with your question?
Yes, I really appreciate the explanation that CanAge is building on age friendly and moving to age inclusiveness, and it's a much more detailed action plan in many ways. But I think the lack of even mentioning age friendly or all the work that's being done on dementia friendly, and I know that those two are working things out, it seemed like an omission rather than building on it. So I appreciate some of the previous comments, and I would like to see age-friendly included in this inclusiveness.
Hi, Valerie. Thank you so much for that. We thought it was infused, but we're happy to take that and we're happy to, broaden that out. So that's excellent feedback from you and Kathleen. And I think that we can make that adjustment.
Thank you. And I just want to acknowledge Professor Suzanne Garon from Quebec, who has developed and led some very, very important work around age-friendly cities and communities and measurement. So I think that's really valuable. I just want to, now we're coming almost to the time when we're going to ask you for your takeaway messages, but I think that we've got another couple of questions. Kathy Wood, would you like to just mention your comment, Kathy? Okay. Look, I'll just mention it, Laura. It's really this tension, around age-friendly and dementia-friendly. And so, I think it was really a question about how do we ensure that there is a connection and that there's a pull through in the practicalities, because they are not separate, but rather, part of the one whole in creating an age-friendly environment. Jan Hively, would you like to come forward with your question and comment? Okay, I will ask it.
There we are. No, I have it now. Thank you.
That's all right.
The comprehensive scope of your planning process has been extraordinary, and we certainly see the breadth of service needs that you appraised. But thinking about it from a complementary perspective, what about self-management and self-advocacy and self-responsibility on the part of all of the people, the residents? Are we encouraging the sense that we are not passive recipients of services, but that it is essential that we think about taking responsibility for ourselves and our self-management, so that it's our responsibility to do as much as we can, including perhaps earning income toward the last breath. But what is it that is needed here from other organizations to complement your work, so that all of us will seek what you have to offer?
Thank you so much, Jan. What I would offer is that when we wrote the roadmap, we did it again, kind of holding the pen to try to capture the collective knowledge of experts, of researchers, of communities. And you will, I hope, have a chance to look at it. And so you'll see that it's not directed to one audience. So this is not a document that is specifically directed to governments. There are some that are, because if we need to change our tax code, the federal government has to do that. If you have to change type of financial regulation, a financial regulator has to do that. And there are call outs. But there is a large number of recommendations about self-management, self-determination, community engagement. In fact, the role of philanthropy is in there as well, and about self-activation. This is really just the beginning. I would love to see, a wide variety of tools as sort of some next steps around pulling out some of these ideas and helping to activate to different audiences.
Wonderful. Thank you.
Yeah, wonderful, great response. Sue Lantz, would you like to come forward?
Oh, I thought you were going to ask me.
I'd love to. Hi, everyone. Laura, congratulations. What a great launch, and very excited to see this national framework. And there's, as you said earlier, it's so exciting because you're giving us a platform for all of us who are involved in this field to sort of play a role in the right way, right? Whether it's NGOs, whether it's policy people, whether it's field people, whether it's seniors themselves. And you've cut a very broad cloth, and I'm very excited. So I am working, and as you know, and have finished a guidebook. It's actually called Options Open, and it's aimed at seniors, younger seniors thinking ahead, taking a travel planning approach. And it really builds very much on the platforms you are talking about, including, as you say, age-friendly community planning and dementia-friendly community planning. These are not things seniors want to think about in terms of their future and the possibility of having dementia, but my book and guide series, workshop series, mode of thinking a little ahead on these fronts. I see helping helping younger seniors actually co-create some of the solutions. So anyways, I'm very excited, and stay tuned for this complimentary work, and I'd love to chat with you more about how we can collaborate.
Okay, thanks very much, Sue. Laura?
No, I say thanks, Sue. Sue's work has been fabulous. We've been able to work together for years, and I'll look forward to looping you back with on that.
Good. And the last question is from Maria.
Hello, everyone. Can you hear me?
Yes, we can.
Yeah. Laura, one of the things that has always struck me when I worked with you is how you embrace groups to make our advocacy stronger. And so my question is, you have raised that this morning and through your research and so on. And I must say that it will garner some political input, because I've been using it as I'm on the board of developing a community hub, and the Premier raised that at one of our town hall meetings. So I'd like to commend you. I'm so delighted with what you're doing, and I'm energized by it. So keep it up. And if I can help, you know where I am.
I do, and I want to thank Maria. For those of you who may not know Maria, she's a tireless seniors advocate and engaged, across this country, but also very much in Ontario. Maria, I will take you up on that.
Okay, thank you.
Okay, so let me just start moving to closing down the town hall this morning. So in a couple of minutes, Laura, I'm going to ask you to make a few comments. But I want to step back for a moment and say we're here because we're in an unprecedented global pandemic that is not going away tomorrow. In fact, we'll be living with COVID, in the months and probably the years to come. Vaccine or no vaccine, there will be an important time when we have to acknowledge that wearing a mask may be the norm versus the unusual. I also want to acknowledge the many hundreds of thousands of people that have been diagnosed and many hundreds of thousands who have died. And not only those that have died, but all the families of their loved ones. Sometimes we're so busy pushing forward in our day that we kind of let that sadness and that grief of the loss of people just slide by. And also those that haven't died from COVID, but their family haven't been able to be with them in those last moments. We're here because town halls are a good way to get to know one another and to connect with one another, and to make sense of the world. I make sense of my world through the lives of other people. This very important roadmap, is the culmination of many thoughts, many bodies of work over many years. And we're blessed that such a gifted person in Laura and her team, has been pulling together. And while acknowledging the many people that have contributed to that. So we thank you, Laura, very much. I've decided to tell you a little personal story that I think is hilarious, but important and remarkable before I hand it over to Laura. And I thank you, Laura, for just a gung-ho town hall. Some of you may know that, that my mum, Billy, is 92. Billy lives in Perth, Western Australia, which is the most isolated city in the world. It's the first time that mum has lived by herself ever in her life. Dad died 2 years ago. And as COVID hit, my brother and sisters, really informed mum that it was critical, to socially isolate, which she does exceedingly well. But I was telling Laura, an important story before we came on. So mum's in lockdown. She doesn't let very many people in and out, but a neighbour came to drop off, as you would guess, the toilet rolls. Everybody needs 1,600 toilet rolls in COVID. So the toilet rolls were put on the table. And after the neighbour left, Mum decided that she needed to make sure that the virus, that cleaning was done appropriately. So on my daily call, Mum said to me, now listen, Jane, listen what I did and tell me if it's okay. So Mum decided to use the insecticide to spray the table, the door handle, everything else, and then got the methylated spirits onto all surfaces as well, and then decided that she needed a shower to put clean clothes on. And she said, what do you think, Jane? And I said, Mum, you've probably killed about everything. My mum's remarkable. She is so courageous. And there are millions of older people out there doing exactly the same thing, being remarkable and being courageous. And this town hall is about remarkable, courageous older people. So Laura, I will leave the floor to you.
Thank you so much, and thank all of you. I guess my last points are 3. This is not just the work of CanAge. We picked up the pen and tried to capture the knowledge and knowledges of so many. The second is we felt that we needed a place to start that was open and inclusive and humble, a place that allowed us to have a platform rather than being told by some type of authority that this is your strategy or this is your direction. So we would love to hear from you what you think. We would love to engage in continuous improvement. That kind of takes me to my 3rd point. This is a working document. Roadmaps need to be updated. They're dynamic by their nature, and they are but a humble representation of the landscape. We hope that in our work, we were able to map out some of the landscape in Canada and provide opportunities for NGOs, governments, organizations, individuals, communities, religious leaders, faith organizations, and other NGOs that wouldn't necessarily think about aging to find connections. So you'll see that in our I, which is infection control, disaster response, we talk about climate change as an example. I want to thank the CanAge team. I cannot tell you the number of hours that went into this work. And I want to thank my team members who are on this call today, but also, a huge shout out to the experts that we worked with and to the people that gave their time. We would really love to hear from you, and we will take your feedback and we will make sure that we activate upon it. And if there's work that you're doing, please let us know so we can continue to incorporate it and keep our roadmap updated.
Thanks very much, Laura. And thank you to Andra Stanku and the IFA team. And we look forward to you being with us next week for a town hall where we're really going to understand the meningitis